So if you personally have lupus, you need to know about these two natural alternatives, okay? What is lupus? It's an autoimmune condition where your body's immune system is attacking itself. It affects the joints, the skin, the kidneys, the blood cells, the heart, the lung. It's triggered by various things. And these triggers will give us clues on a solution. One is UV light. Number two, birth control. That's estrogen. Low vitamin D levels. Certain drugs. And stress. Many people who experience lupus get it after a stress event, an emotional loss or some trauma. The symptoms, joint pain, fever, rash, fatigue, ulcers in the mouth, swollen lymph nodes and other glands, sensitivity to light. It's called the great imitator because it mimics so many other conditions, okay? So there's some interesting clues about this condition. Number one, 9 out of 10 adults who get lupus are women, okay? So if we look back to those triggers, estrogen involved, okay, that could be a trigger. Next one, African Americans are 3 times more likely to get lupus. Wow. And they're probably going to be women because 9 out of 10 adults who have lupus are women. As a side note, African Americans are 3 times more likely to get asthma. Okay, is there a connection? The next clue is this. 80% of African Americans are vitamin D deficient. You can greatly improve asthma with vitamin D, and you can greatly improve lupus with vitamin D, as I'll talk about in the next slide. One big common treatment for lupus is using corticosteroids, okay? It's an anti-inflammatory. It's a synthetic version of your adrenal hormone, cortisol. Okay, here are the two things. Vitamin D. Why? Because vitamin D is an immune modulator. It regulates and controls the immune system. There are vitamin D receptors in nearly every single immune cell. Vitamin D is anti-inflammatory. And vitamin D is not really a vitamin. It's a steroid hormone that mimics cortisol. It has very similar effects to cortisol. Remember we talked about this corticosteroid? So vitamin D can create a similar effect. So vitamin D would be the first alternative. I would highly recommend doing 20,000 IUs at least. Why wouldn't we use a lesser amount? These RDAs were not figured out to create therapeutic benefits for other conditions. It was merely developed to avoid rickets. And if you personally are going to take higher amounts of vitamin D, I put a video down below just so you can get the full understanding of some other things you need to do, like vitamin K2 and magnesium. So you can check that video out. Next one is fasting, as in intermittent fasting. Fasting can increase your T cells dramatically. I'll put some links down below. Fascinating research with lupus. Fasting can restore the stem cells that actually make up your immune system. Fasting gets rid of inflammation. It's anti-inflammatory. And the biggest symptom or destructive effect of lupus is inflammation. So if you can actually get rid of inflammation by using these two things right here, you can hopefully put this lupus in remission. And the last thing I want to mention is this is not meant to replace your medical care. And check with your doctor before altering your medications or adding anything else to your current treatment. Thanks for watching. So if you want to get notified with all my content, click the notification bell next to subscribed.